Alright, well, welcome to another audio lecture. In this lecture, we're going to be talking about peripheral vascular disease and then coronary artery disease in the same lecture. So, what are these conditions? Well, these are conditions that are going to impact perfusion. These are going to be conditions that deal with abnormal arteries now. Okay, so it is narrowing of the peripheral vessels, specifically for peripheral vascular disease, which I'll generally abbreviate PVD. And so we see that peripheral vascular disease is going to be narrowing of the blood vessels. So what causes peripheral vascular disease? Um, Atherosclerosis, so hardening of the arteries, and we can see some examples right here. This could be the result of potentially vasospasms, altering blood flow to the periphery. And so this is an example of Raynaud's disease, okay, where we get some vasospasm. You can see we have the areas of red, which means it's getting lots of blood flow, and we have hyperemia occurring. And then we have areas where the arteries have vasoconstricted through vasospasm, cutting off blood flow to certain regions of the extremities. Thrombus formation. So if clots form, they prevent blood flow, and so they block arteries and prevent that area from receiving blood flow. Okay. Inflammation. And so we see inflammation when inflammation runs awry or when it goes out of control. Inflammatory events can disrupt blood flow as well, and this is largely due to chemicals that are attracting white blood cells to the area, initiating damage, and then atherosclerosis is obviously going to occur when we get this uncontrolled inflammatory event. We have thrombus obliterans, and so thrombus obliterans is the example of the hyperinflammatory event that we see. So we see that the blood vessels here have constricted because that we get this increased inflammatory response, resulting in necrosis of tissue, highlighted here by the black skin on the toe. And these vasospasms that result from that can result in Raynaud's disease. So how does this PVD manifest itself? It oftentimes is related to tissue ischemia. Remember, ischemia is the decrease in blood flow, and the decrease in blood flow decreases oxygen delivery, right? So if we decrease oxygen delivery, we have reduced capacity to produce ATP, and you end up getting those cells dying in that area, and then the tissues themselves die. Now, this generally affects the extremities, and it occurs, it is exacerbated by activity, right? So we can see it generally occur in these active events. We see some other manifestations in being pain. This is probably due to neural dysfunction. And if, again, the decrease in oxygen is really going to be causing all this, right? So if we decrease oxygen, decrease ATP, we decrease sodium potassium pumps, and we could get some neural pain and hypersensitivity occurring there. So we have this event called intermittent claudication, and this is going to be pain in the legs with activity. And this kind of goes in the same note. If you are preventing adequate blood flow, you start to see dysfunction, right, with the nerves and even inflammatory events, right? So if the inflammatory events are running out of control, now this inflammatory event is further decreasing oxygen delivery as well. The numbness and the burning, these are due to neural dysfunction, or likely due to neural dysfunction. And then the non-healing wounds would make sense because as we start to heal, we need ATP, or we need oxygen brought to that area, not because oxygen helps kill some bacteria, but we see it really involved in producing materials that are using that are involved in healing the actual wounds. So we see skin color changes, and hopefully you're familiar with these three terms: pallor, cyanosis, and rubor. If you're not, I will describe them here for you once again. So pallor is going to be a pale appearance because you have a decrease in blood flow. Cyanosis is the blue appearance to skin because now it is you have an increasing incidence of deoxygenated hemoglobin circulating through your system. And rubor is going to be red. Okay, and so we could get hair loss in areas that are affected by this peripheral vascular disease, and oftentimes we'll find areas on the legs that are hairless, and then what every man fears is impotency, right? And so here's international cigarette cartons. This I don't know where this one is from. Looks like Spain or Mexico maybe. So we had so when you go internationally, you will find these cigarettes ads, and if anybody's been internationally or traveled internationally, you see that the smoking cessation ads on cigarette cartons are really graphic, and oftentimes they involve things that people are very afraid of, like impotence for males. Okay. All right, so you are going to diagnose peripheral vascular disease through a medical history and a physical exam. So if you suffer from hypertension, diabetes, or you have a history of smoking, that might be enough of a history. But oftentimes it's combined with indicators like lower leg pain while you're walking. Okay? And to diagnose this, we're actually going to use a little bit of different diagnostic tests here compared to what we've seen before, in that we have an ankle brachial index, and it looks like blood pressure compared to your brachial artery, and then in your lower leg, we're going to wrap it around your ankle, and we're going to look at blood pressure in your lower leg. And so then we compare those values, and depending on where you fall in the index, would dictate whether the physician at that time thinks that you might have peripheral vascular disease. If they think that you do have peripheral vascular disease, they might induce an exercise test, right? And so just getting the blood moving through your body, they might have you walk on a treadmill for a little bit. It's important to note that on the ankle brachial tests, they're probably going to have you relax for a prolonged amount of time. They will verify these findings with an angiography, so they insert a dye. They visualize the flow through the arteries, and they're looking now for any kind of obstruction to that blood flow. They might use ultrasound, and so ultrasound obviously is picking up the sound of the blood flow, and this would allow them to detect any kind of abnormal blood flow and turbulent blood flow in particular. And then they might visualize it using an MRI, magnetic resonance imaging, to visualize the actual blood flow. All right, so how are you going to treat peripheral vascular disease? First and foremost, you're going to try to make lifestyle changes, right? So you're going to try to get some more exercise. If you smoke, you're going to quit smoking. You're going to eat healthier. And if you eat healthier, you're probably going to increase your physical activity a little bit more, because now you would actually be able to do it. You would lose weight, your diabetes would come into control, and your hypertension would likely come into control there too. And then this physical activity would work in reducing stress, because they've shown and demonstrated that increased physical activity decreases stress, right? So these are pretty big lifestyle changes, but they're better than dying. And I think that this would probably be the easier and more affordable way to get out of this. And so next up, we're going to talk about some surgical and pharmacological interventions that one could use. All right, so we're going to treat this condition by targeting the occlusion. If the lifestyle modifications don't work, using angioplasty, which is inserting a balloon, trying to compress the plaques against the wall, opening up the artery. Bypass surgery if we can't open it up enough, and we need to make sure we can provide blood flow to that area. Laser procedures would be targeted, and we would try to put those in to break up any kind of thrombi that is formed. And a thyroidectomy is actually going to bore out a hole of the plaque in the artery, and then open up that vessel that way. Now, Obviously, we're going to use pharmacological therapy in conjunction with some of this stuff, so like antiplatelet agents. So antiplatelet agents would prevent platelets from sticking together and prevent thrombus formation. Now that obviously introduce a risk of potential clot prevention, um, and then you take the risk of a little bit of damage causing a lot of bleeding, right? And depending on what antiplatelet agent you use, it could cause a pretty big problem. We have anticoagulants, which prevent blood clot formation altogether by usually inhibiting clotting factors. Thrombolytics would bust clots, right? So the platelet plug that is forming, and lipid lowering agents that are going to target dyslipidemia, um, and try to get those levels in control. So with that said, I would like to end the audio lecture, and I would also like to encourage you to look up some of these procedures here, and know what these are, because I think they're kind of interesting to know about and being familiar with this kind of treatment, and then also know what the different types of pharmacological approaches are and why we would use those. So until next time.